So, guys, we're live. Thank you, Carl. I'm going to pass over to you.
Excellent. So I am, for those that don't know, I'm Carl Payson, the founder of Noble Just Natural Health for Dogs and one of the directors of Pet. I'm very excited to be joined tonight by my lovely friend Joe Flanagan from Ingenious Probiotics, Sean from Tvati, and Dr. Katie Kangas. They are going to be telling us all about Tvati, what it does, how it works. This is so important for dogs and humans with mobility issues. But even if your dog doesn't have any mobility issues just yet, it's definitely one to watch so you know for future reference. So I'm going to hand over to you, Joe, so you can introduce Sean and we can hear a little bit more about Tavati.
Yeah, thanks, Carla. I'm going to frame out a little bit of the background to this because I think that's really important, particularly for your audience. So, yeah, some of you will know already how we got involved in the pet care world, and we came in sideways, basically from a whole different sector, and we were taken aback by issues we were finding out that pets were having issues that my grandparents' dogs never had, our cats never had, and we found these things were epidemic almost, and it's been a real journey for us. And what's happened over the past few years, then we've looking back at the numbers, and we've helped literally thousands and thousands of dogs, mostly dogs, some other animals too, but mostly dogs, with skin issues, with dental issues, and ear issues in particular, other things as well, and reducing their chemical exposure, as you guys probably know already. So, but in the early days, we were looking at this from a point of ignorance. We're looking at this situation, going with having come into it sideways, going, this is strange, and my vet friend Richard Doyle was telling me about skin issues around dogs with dermatitis. I'm going, why? What? This doesn't make sense as somebody just
Mm.
coming in. So we were in this period of discovery. And we started talking about one of the things that just seemed so obvious to me was dental health. So I'm looking at dental health and we're talking about it and thinking, are we nuts? Because are we stupid because we've come into this sideways? And then I saw a presentation by a certain Dr. Katie Kangas. Ta-da. And I was really inspired because I thought, right, if somebody, this well informed, this professional and clever, is saying some of the same things we're saying, that I must be on the right track. And it was a real time for us to go, okay, yeah, what we're doing here is a good thing, and we're on the right track. We're not just stupid,
Mm.
you know. So that kept us going. So we were delighted then last year to meet Katie. We bumped into Katie at Dr. Morgan's, Judy Morgan's thing early last year, and I had a little bit of a tongue-tied moment because for me this was a big deal meeting Dr. Katie. So I'm saying this so people as a frame of reference, and that becomes important in my next sentence. So we got to know each other a little bit. Clayton was there, you remember, and fortune had it that this event had actually been moved back 6 months. It was supposed to take place the previous October, got cancelled at the last minute due to a hurricane in Florida where the event was happening. And of course, Clayton wouldn't have been with us then. So this is really great that all these things started aligning. So anyway, I untied my tongue and spoke like a normal human to Dr. Katie. So, but we're forever in your debt, Katie. Thank you for your inspiration. Around the same time, Clayton, and we all know Clayton. For anybody who doesn't, go to the podcast Pet Business Disruptors and have yourself a good time listening to some fantastic insights about the pet industry. Um, so Clayton had introduced us to Sean and Sean's business partner Romeo, wonderful guys. And Clayton had said, "Look, Joe, you're on the topical side of things, and you need to speak to these guys." And I'm like, "Huh? What? Okay." And then speaking to Sean and Romeo, I was like, "Okay, I can tell who these guys are straight away. The efficacy, the ethics, everything was just." the things we love to speak about in groups like yours, Carl, and the kind of people we hope that we maybe are ourselves, you know. So this was a great thing. Now with the finding out about the product, and we had some good results with some pets when we brought the product over. But just go back to something I said a few minutes ago. We've been having thousands of dogs, thousands, and we take the trust that pet guardians have placed on us. That's like sacrosanct, you know. It's really, really important to us. It means a hell of a lot. Makes us feel 10 feet tall, and from a personal point of view. But for us to introduce a new product means we are really, really into this because we take the trust of our pet guardians, the people who've trusted us. We take that so sincerely. So we wanted to introduce Tvati. Thought this is great, fits right in. And then earlier this year, I started using it on myself. Sean will tell you more about the actual product, but it comes from the human world. And I used it on myself. And on the 1st of March, and I'm using it. I'm going, okay, and I'm whatever. And I'm just seeing, I'm just seeing, am I seeing anything different? Am I not seeing anything different? And then on the 12th of April, so it took me 35 days to do the 30-day protocol because, yes, I missed a couple of days. No biggie. So, so on this day, on the 12th of April, I'm on a boat. I'm on holidays. I'm talking to a friend, and I suddenly think there's something different. There's something not right with this current situation, and I'm not sure what it is. And it took the brain, because obviously I'm not that clever, it took the brain a few minutes to understand, oh, I'm down in my honkers. I don't normally do that. I don't normally squat down in my honkers because I can do it for a little while, but then getting back up is just a bugger, right? It's really, really difficult. You know, sort of getting holds of handles and push myself up like someone. I'm feeling, you know, not feeling great about it. So I'm in my honkers and I go, okay, let's stand up. And I stood up and I went, that was easy. And it's like, what have I been doing different? And again, being clever, took a minute. Janie Mac, this is it, this is it. And then I noticed I was walking with much less pain. Now I wasn't in agony before, but I had mild pain when I was walking, slightly more when I was walking uphill, slightly more again when I was walking downhill. At this stage, I'd had the MRI results through. They'd confirmed mild arthritis in my left knee and moderate arthritis in my right knee. My right knee's got no anterior cruciate ligament due to a happy incident during a football match about 15 years ago. Sean, you know the kind of thing I'm talking about, right? So that was fun. And I never had the reconstruction surgery because the doctor told me I'd need to take 6 weeks off work, and I thought, well, that's not going to happen. So this was my personal journey, and all of a sudden I'm going, okay, we've been looking to try this out. We've been holding the guardianship of the people who've put their trust in us so strongly. We've been holding it too tight. I need to let people know about this. So at that point, we started talking a bit more. So here we are today. Now I needed to frame that out to everybody so they know what they're about to listen to is pretty strong stuff. Sean, rather than me go on about what I know about the product and its wonderful background, it's so interesting. Can I pass that baton over to you? And thanks again. I know it's 5 o'clock in the morning, 5:10 in Australia, where you are, mate. So thanks for being up, and sorry about the Australian result yesterday.
Thanks for that reminder, Joe. I really appreciate the reminder about the football. Thank you. But look, guys, kia ora. It's an absolute privilege for me to be here today. My name is Sean Cahill. I am one of the co-founders of Tvati, and as I said, it's a privilege to be able to share something that I've just grown up with my whole life, using it personally as our ancestors intended. And I'll get into how we fell into the animal market. But so Tvati is a product that comes from the name of Te Varu Aku Ati. And essentially, it means medicine juice in our culture and our language from the Cook Islands. Tvati is a product that contains two ingredients, two natural ingredients, which is hibiscus bark oil and organic coconut oil. We can't say the hibiscus bark oil is organic because we don't have a piece of paper that says organic. But what I can say is that the hibiscus grows wildly in the Cook Islands. The The Cook Islands has 15 islands where we are able to harvest the bark, and how we harvest that is by hand. Our locals and the Kotonui, which are our traditional elders, go out into our plantations and out into where the hibiscus bark, the trees grow, and we harvest it by hand. So when we're harvesting, it's a third of the tree is only ever harvested. And then that goes through an extraction point of using ethanol, then being able to bring out the oil of the bark. And then that's processed in our laboratory in the Cook Islands, which the Cook Islands is one of the smallest Pacific islands of the Pacific nations. And when we say we have a laboratory, we have a laboratory that has machinery as such as called a mass spectrometer. And what that enables us to do is to make sure that every single batch that we manufacture in the Cook Islands is exactly the same batch, and there's no differences whatsoever with that. In the olden days, as I said, this oil was used by our ancestors and our grandparents and our parents to assist and support bone healing. And in the Cook Islands and Pacific nations, there was no such thing as getting pills and stuff like that because there was no such thing back in those days. So if one of our people was injured playing rugby, playing soccer, whatever it might have been, our elders went out into the plantations, identified the plant, and then put the plant in coconut oil, sorry, and then applied it to the skin. So it's interesting, Joe, because you said before, we started in the human's face, and that's true. This is where this all starts. But in our culture, there's no such thing as a product for a human and or animal. The one supports all. And I think that's a really important thing to start off with, because in today's society, we're taught that there's a product for a human, but there's also a product specifically for an animal. And we know that due to marketing and these marketing beasts out there, they've been really, really, really good at being able to educate us now of how products are administered, etc. But we intended to keep this as Mother Nature intended, naturally and simply, from Mother Nature and from the earth, and to grow it wildly. The difference with what we do at Tvati is, as I said this there, it's not a product you induce. It's not a product that you have to inject. It's a topical. So it's a topical product where it doesn't matter where you apply the product. What happens is it absorbs in through the skin. So you apply it to the skin. It absorbs in through your skin into your bloodstream and identifies markers to assist in that support. Our journey bringing Tvati to the market is really interesting. I mentioned just earlier the Kotonui. Our founder, Dr. Matheson, who's a native Cook Islander, he was awarded a scholarship to come to Australia, where myself, Romeo, and Dr. Matheson are all based. And during the time of him becoming a doctor, he met another gentleman called Professor Bill Walsh. Now, he's the head of University of New South Wales here in Sydney, Australia. He's an America from Brown University that came to Australia to run the research lab here. During the time of Dr. Matheson, who, by the way, we call Cookie because he's from the Cook Islands, he befriended Professor Bill Walsh. And during this time, they were doing studies on bone morphogenics for American companies getting FDA approval. And Cookie said to Professor Bill Walsh, he said, listen, I know we're doing all these studies on bone products, etc., but in the Cook Islands, we use plants to heal. And he got the look that I think we all sort of get when you mention something that no one really believes. And he was like, okay, and sort of brushed it off. And then Cookie, being Cookie, was really persistent and said, no. We apply it topically and just with coconut oil, and it assists with bone, soft tissue sort of growth in as our ancestors intended. So he said, okay, well, there's my lab, prove it. And over the next 7 years, Cookie was able to get approval to bring the plants into Australia to try and identify and prove that what this our ancestors had taught us was actually true. So Cookie went through a whole process of 7 years worth of studies, and 7 years later, I'm really proud to say that he was awarded a PhD here in Australia. To take that a little bit further, he was then awarded global patents on the oil, Tvati oil, to show that it rejuvenated bone, soft tissue, and cartilage. And not just on the formulation, which is what most patents sort of stand for. The patent was also granted on the fact that it did grow bone, soft tissue, and cartilage topically with two natural ingredients that are 100% natural, that has never been seen before in medicine. Now, they call this novel because we've carried out a PhD, and I know the questions will come in and say, have we done clinical studies? And the answer to that is no. So then Cookie and I, being really close friends, we developed the product and named it Tvati after Te Varoako Ati, which is very, very hard for me to say. But for someone else to say, it'd be even more difficult. So we abbreviated the word and called it Tvati. We took it into the sports arena, which is our backgrounds. We know the area really well. We have a significant industry network in that industry, and we started to assist athletes all over the world in regards to recovery from acute injury, prevention of injury, that whole type of realm. Now, athletes have a lot of money and they spend their money on a whole heap of things. And I got a phone call one afternoon, and this is probably 3 years into the journey of working really hard in the human space. And he said, Sean, my horse has broken down and it smashed its hock. And I'm like, oh man, I'm really sorry to hear that. And to be honest, I 5, 6 years ago, I didn't even know what a hock was. So I'm quickly Googling what a hock is, and I'm like, okay, check. Yep, okay, I know what a hock is now. And he said, listen, can I use my Tvati on my horse? I'm like, yeah, of course you can. He goes, oh, is it for animals too? And I said, mate, in my culture, there's no such thing as a product for a human or an animal. He introduced me to the trainer of the horse, and I told the trainer, and he gave me the weird look and said, what do you mean I don't inject this? Because typically that's what you need to do. And I said, no, just apply the Tvati oil to the horse's withers, so up towards just above on the neck. I think it was about 3, maybe 4 months later, I get a phone call, and it's my mate it's the athlete who's now a friend, said, Sean, you're never going to believe this, but we took the horse back to the vet, and the vet couldn't see where the fractures were in the hock. And I sort of giggled to myself, and I go, oh, wow, that's great news. Congratulations. And sort of hung the phone up. And before I got the chance to hang up, he goes, but Sean, our horse has come back and it's won its first race. I'm like, oh, congratulations. You must have a great trainer. And he goes, no, the trainer's sort of scratching his head too, because they said that this horse will never come back and race again. And I'm like, I'm really happy for you. My phone then starts ringing, and it's another trainer. And look, my background isn't horse racing or anything or racing full stop. Hi, my name is such and such. I'm like, hi, such and such. Nice to meet you. How can I help you? And he goes, I want the Tahiti oil and I need it ASAP. I've got a broken down horse. And I said, look, mate, I wish I was in Tahiti. The product's called Tvati and it's from the Cook Islands. So the horse uses it. I think the horse snapped the tendon and the tendon healed. They couldn't feel where the tendon had been sewn up. But then when they did the MRI, there was zero scar tissue. So my phone just keeps on ringing and ringing and ringing. And I'm like, I can't keep on talking directly to the trainers. I need to speak to vets because I'm not a vet. My background's not vet. I've played a bit of semi-pro football. I know sport. That's what I know. I know it really well, and I don't know much about animals. So I was basically doing exactly what I was doing now, sitting there talking about my culture, talking about, what my ancestors used the product for. And I now find myself being invited to horse racing all over the Australian, New Zealand markets. And I'm like, thank you for the invitation, but I don't like horse racing. So I'm just going to go hang out with my wife and kids and, that's it. And the whole thing for me was never about the horse racing itself. It was always about the well-being of the animal, which is what I wanted to help with. But if the horse was racing and it broken down, I wanted to help. And the trainers kept on saying to me, "Oh, how much is this product?" And I'm like, "I don't want your money, mate. I just want to help the horse." Because we weren't commercializing a equine product or anything like that at the time. We were just trying to help. So I then got introduced to a vet here in the Australian market, and I think for half an hour, the bloke just kept on turning his head like this, going, "Really?" Like he's giving me the look and thinking this guy's smoking some wacky backy, or I don't know what he thought, but he was just like, "There's something wrong with me." And I'm like, "Mate, I'm not trying to sell you a product. I'm just educating you." And he was like, "Okay." And he goes, "Look, I've seen these horses come back in. What do you mean you don't inject this product? Because uh, that's how a lot of products are administered. You've either got to open up the area, inject a product onto the area, hope it works, to then sew the area back up, to hope it doesn't get infected, to hope that this animal heals." And I said, "No, you just apply the product to the withers." Long story short, um, we moved into the equine world, and the vets were saying, "Hey, Sean, we're getting a lot of demand from the horse owners that can they use this on their dogs?" And now I'm giving these vets a weird look. So I'm like, "Of course you can." We then commercialized Tvati Pet. And this is where the whole story starts of us being in the Australian market and people in America saying, "Hey, is this product available in America? Is it available in the UK or Ireland?" And me being me, I'm like, "Yes, it's available." And then saying to Romeo, "Well, how do we do this now?" So 10 months ago, we basically launched at Super Zoo in Las Vegas, and we launched in the emerging brand section. And it was a real small little booth where we put our products up there, where two guys who have never been to a pet show in their life stood there hoping that we'd speak to one person. Well, I'm glad to say we spoke to more than one person. We spoke to a shit ton of people that came down. And I think the other vendors that were around us were really, at the start, really upset with us because we had that many people coming to us and saying, "We've heard that this is a topical. Please explain." I'm like, "Well, here's the vial," which Dr. Katie, I can see the pack in the background. I know she's got some vials. It's a vial that you snap the top off, you apply it to your dog's neck, you rub it in really well, like you're giving your dog a hug, and off you go. And they're like, "Oh, but I don't need to hide this in the dog's treat. It's not a chew, it's not a supplement." I'm like, "No, no, no, no. Just apply it to the neck." And I think what had happened and what we now know is that Tavati's created a new category, as in topical. The pet world knows supplements, as in powders, chews, a whole heap of different products. And in 10 months, well, let's wind back a bit. Sorry, at Super Zoo, we were really, really fortunate to meet Dr. Katie Kangas. But before we met Katie, we saw this chick, and she had a whole heap of hair, and she was pointing to all these women behind her, and Romeo and I are standing there going, "Is this chick pointing towards us?" And anyway, they start walking towards us, and I take a deep breath going, "Oh man, I don't know if this is going to be good or if this is going to be bad," but take a deep breath and hold on for dear life. And it turned out it was Dr. Katie's vet tech, Jessica Lee, who's a phenomenal human being. And she's like, "I used your product. I didn't want to touch my dogs with your product first, and I can't believe what happened." And I'm like, "Oh man." I took the deep breath, came out, and I started to relax a bit. And she said, "I broke my ankle, and I heard about your product from a guy called Clayton Payne, who Joe touched on earlier, who's the host of the Pet Business Disruptors." And he, which Cookie and myself had been on the podcast, we gifted Clayton some packs, and he had sent the product to Jessica, and she used it. And it was, I think it was either the pet product she used, or it might have been Tvati Traditional. I'm not 100% sure. She was trying to fix her broken ankle, which she just didn't have no luck. And within a short period of time, Jessica's ankle was in zero pain. And, she said to us, before I was even going to consider this for my dog, I wanted to use it on myself first to make sure I was happy first. And that blew my mind. And so this is where the whole journey of us meeting Dr. Katie Kangas, Dr. Laurie Parker, Dr. Barry Sands, Joe, etc., at Super Zoo. And 10 months later, I'm really proud to say we work right alongside Dr. Katie Kangas as our chief veterinarian wellbeing officer. And it's probably a great conduit now to sort of hand over to you, Katie, because I think I've been talking just a bit too long.
Thank you, Sean, and thank you, Joe, for leading us into this great discussion, because in a moment I'll back up and just tell everybody a little bit about who I am. But I would love to pick up from the story that Joe started, Sean expanded on, because connecting the dots of that full story is really cool. In the synchronicity of how this happened is Jessica, who Sean was referring to with a whole heap of beautiful hair, is my practice manager and vet assistant, and she happened to break her foot ankle right before we went to see Dr. Judy Morgan's or went to Dr. Judy Morgan's event, where we meet Joe and Clayton Payne, and they're watching Jessica hobble around, and she had a little knee scooter because she couldn't put weight on her foot, and we were a spectacle coming into the lobby with all this luggage, and she's on a scooter and she's trailing a wagon because we have an exhibit for our products, etc. And Joe comes running over to help us, being so kind and gracious, and then we find out who each other is, and boom. Well, we meet Clayton the next day, and he says, hey, for your broken foot, I have a product that will help to heal that. It's a topical hibiscus oil. And even Jessica, with all of our holistic plant medicine background, I'll give you a little bit of my background in a moment, she even said, what? That sounds like a stretch. What is that? Snake oil? What kind of oil is that? Yep. And so Clayton said he didn't have it with him. He sent it to her when he got back to the UK and sent it to her. And she literally was waking up in the night with just nerve pain, like just, acute pain spasms. And within 3 days of starting it, she was like, oh my God, I'm sleeping through the night. Like my pain is down. And now, mind you, we were told a bit about the product in the fact that it's been well studied. And even though Sean said there aren't like clinical studies of following people or pets when they, are using it, but there was 7 years of studies to show that this helps to upregulate bone healing, soft tissue, ligament, tendon healing. That was proven, with x-rays and, imaging and all of that kind of stuff. So, but she wasn't expecting it to do anything for pain. She just wanted her darn foot to heal because it was this lagging injury that wasn't healing. And so anyways, going on, her foot heals very quickly after that, after she started using Tvati. And so she's like, okay, if this is working for me, I'm going to try this on my dog. And so this is a little bit of a unique story in the fact that her dog, and I'll get into what it does for just regular orthopedic and injury healing, but she has a Cavalier King Charles Spaniel, which of course is a British breed, which is great. And that breed is very, there's a high percentage of those dogs that have a syndrome called Chiari malformation, which we call CM, or is the acronym CM. And it's not a bony injury, but it does cause a lot of pain because of the skull, connection to, the spinal cord area with the amount of pressure that's coming out. And they end up with a lot of nerve-related pain. And so her dog for years, Hamilton is 8 now, his name is Hamilton, he had experienced many episodes a day of pain and neck pain, and he would vocalize and get all agitated. And when she started using Tvati on Hamilton, she's like, I'll just try it. I can't imagine what, it would do for him, but it certainly can't hurt. And so she starts using it on Hamilton, and within 2 weeks, she was like, I don't have to use CBD anymore. He's not, and she had, by the way, he had been on many pharmaceuticals He'd seen neurologists, all this stuff. He was on, 3 medications at one time, when this first started. He is now off all medications. And he literally went from having multiple pain episodes a day to like one a month that's really triggered by grooming. So fast forward a little bit into when I met Cookie, Dr. Graham Matheson, who is an MD but got his PhD, doing these studies as well. He starts telling me about, the history of how this product works. And I, of course, come from a background of I'm an integrative veterinarian, holistic veterinarian. I've actually been a vet for over 30 years. I've been in the integrative space for more than 20 years. So I am, very rooted in plant medicine, natural support to healing. And so when I saw Jessica and Hamilton get these great results, I, of course, wanted to meet Dr. Matheson, which I have since done and had several conversations. I did want to connect the dots really quick. So when we ran up to their booth, the Tvati booth at Super Zoo, it's because Jessica had already had her own healing experience using Tvati. It was just fresh on the plate of she got to see her dog Hamilton's results. So she was over the moon passionate about this Tvati product. And fortunately, she has networked to many, many people in the pet health space and the pet, retail space. So she's literally like a tour guide, funneling everybody over to the Tvati booth. So their booth was literally getting rushed with groups of people and booths surrounding them. They're like, why are all these people coming to you guys? So it was really neat that, and one thing I would love to say to everyone in this group, all the listeners and members, is that whether you enter the finding the results of Tvati for your pet or for yourself, either way, it's golden. Because some people use it on themselves and are like, oh my God, I can't wait to use this for my pets. And some people, it's the other way around. They find it because of their pets and they see their pets, get the benefit. And then they're like, okay, now I got to use it on myself. So again, the beauty of natural plant medicine, serving all species, not being only human, not being only pet, but Sean and Romeo, the Tvati team, did create specific packaging for the equine, the pet, and the human, the traditional. And I know so many pets and people at this point who have had really phenomenal results with this product, that it really jazzed me up and I wanted to learn more and help this product to get to more people. So really supporting this company and supporting their mission. And one of the things that I was always attracted to when I met Dr. Matheson and Sean and Romeo, like Joe said, right away, you can tell the integrity, the authenticity, and the intention of the people behind this product is, top notch. And the fact that Dr. Matheson got permission from, the elder community, the traditional community there to study that product, and achieved the patent, which is very difficult to do internationally, so that that product would never be abused or over harvested or changed from its original format by turning it into a chemical alteration of this natural, beautiful plant medicine and the wisdom that it carries. And so I was so, just impressed and attached to that story of how this started, that I really wanted to be helpful in getting it out there. So what I have seen now is, just tremendous from, cats, dogs, again, humans. I don't work directly with horses, but I get to hear a lot of feedback through all the networking. But again, I'll step back and say that it's patented for bone and soft tissue repair. We do see it definitely for humans and for animals. Pain levels go down because pets feel better, humans feel better, less pain, etc. But those two magical ingredients, the hibiscus bark extract and the coconut oil paired together. And by the way, Dr. Matheson's studies, without the coconut oil, the result wasn't the same. It's so fascinating that just the hibiscus bark extract oil without the coconut oil didn't get the same
Doesn't
outcome.
work.
Yeah. And they literally showed like bony defects, non-unions of several centimeters of separation of missing bone. And they got new bone growth within 7 days. Amazing. And they also had a spinal fusion model where the spine actually healed and remodeled very quickly with bone marrow regrowth. I mean, this is like knock your socks off type stuff that we're seeing in studies. The other thing that I thought was very cool, because I come from a background of plant medicine and you know, holistic and herbal, is that in order to achieve the international patents for this product, the you know, the groups from India and China were opposing, saying, no, we have, you know, we have herbs that do that. And so the clinical or the, you know, the lab studies that were done on Tvati showed that this is absolutely unique. There is nothing from amazing, you know, traditions of Ayurvedic and Chinese herbals that did the same thing. And then you add in the fact that this is topical. You know, that is such a unique and precious part of this, you know, the beauty of this product, because in my space, in helping to treat pet patients, one of the challenges for a lot of pet parents and a lot of pets is the number of supplements. And Sean kind of mentioned, you know, a lot of stuff is powders, there could be chews, the capsules, tablets, liquid herbal tonics, you know, homeopathy, which, you know, I create as well. But it's a lot of stuff to give pets. And you start overloading their meals with too many things. And part of my value when I work directly with clients, and I do a lot of telemedicine, really around the world even, is part of my value to people is helping them streamline, because sometimes they're using too many things and it's starting to overwhelm the pet system and possibly put them off their food because there's too much stuff being added in. So everyone's jazzed, why wouldn't they be, about the fact that it's topical. It is so easy to use, to apply, and the packaging, you know, they're packaged separately, and you can, you know, like Sean said, it's the same product. They come in different volumes, just so everybody knows. The pet product for dog and cat in these tubes, and originally when, you know, the product first came out, it was in a larger bottle where you had to measure from a dropper how much you were giving. Sean and Romeo updated it with making a very user-friendly package where there's daily tubes. And so you just crack the top on the tube and then you can apply the volume in the tube. The pet product has a 0.5 ml, 0.5 ml. The human product has 1 ml and the equine product has 2 mLs. And so it's very easy to apply this daily amount. It's a very small amount. I mean, it's just so surprising that this works so well. And as Sean mentioned, you can put it anywhere. In the studies, you know, they would put it on, you know, they didn't actually put it on the injured area and it still works. Yeah.
So Katie, if you had if you were talking to a pet guardian, what would you say to look out for? You know, what symptoms are they looking at in their pet, particularly their dog, where they're going to go, right, the Tvati can help with this. What would you get them to look out for?
Yes, thank you. So anything with mobility for sure. Certainly injury. I mean, that's obviously where the product originated, was to address injury. And so anything with an acute injury, whether that is a bone fracture or even a tendon or ligament injury, and in, you know, canine, you know, in dog health care, cruciate ligament injuries are an extremely common thing in dogs. I mean, it's one of the most common orthopedic injuries that will cause lameness, etc. But certainly if there's any lameness, limping, ligament injuries, any acute injury, absolutely Tvati makes sense, and it, you know, should shine there. The other thing though that's really important for everybody to know is that it is equally effective and helpful for ongoing and chronic injuries and arthritis. And when it first came out, you know, to heal bone, you wouldn't think that maybe with arthritis it would be so helpful, but we see it is on the animal side and the human side. And that makes sense because really ongoing arthritis or, chronic inflammatory conditions that are affecting joints and musculoskeletal tissues, oftentimes are a series of micro injuries, micro, fractures and
Fractures. Yeah.
cracks, yep, in the bone or in the joint. And so that joint's already weakened, or there's already been some injury in the past, or, some arthritis. And so that ongoing process continues the inflammation and therefore the continued pain, etc. So using the Tvati in chronic situations is extremely helpful. So it really gives a broad scope of the value of what it's used for. And I now see when we're using it on dogs, they're, and when by the way, Hamilton, who I said stopped having episodes, he's 8 years old. He hadn't played with toys in years. He's playing with toys again. She's like, oh my gosh, this is amazing. It's the only thing she did differently. He goes to the park, he engages with other dogs. He used to always just stay by himself. She thought he just wasn't that, social and didn't care for toys anymore. Now we know in hindsight, he just feels so much better now that he's doing these things. Also, yeah.
So that's really interesting what you said as well about the supplements there, Katie. So that's something I never considered that there could be too much going on. But if the dog is on a supplement or whatever, the pet guardian can continue that, can't they? And then just do the
Yeah.
Tvati as well.
Absolutely. And so Tvati, of course, being topical, can pair along with anything else without sort of adding strain of something being ingested.
Mm.
The other beautiful thing is that even though I always, and people in space like this with holistic and integrative interests, we're always wanting to support people to remove or reduce pharmaceuticals and medications. And of course, oftentimes we can be successful in doing that by turning to wonderful plant medicine tools and other holistic tools. But in some circumstances, a pet may still need to be on, or a human, on pharmaceuticals. And so again, Tvati is fantastic in the fact that it can help to reduce the need for pharmaceuticals, but if you are on them, you can still use it in a paired fashion or an addition because it's not negating or impacting anything else. So that's a big strength of it as well.
Oh, brilliant. Yeah.
I have a question. I think what you've just said there about the pharmaceuticals is amazing, because I think quite often in the natural space, some people can get really fixated on only doing things naturally, and then their dogs end up in a lot of pain just for the sake of staying natural, which I don't agree with. I think things have to, we have to have a balanced view, especially when it comes to pain. So having something that you can use together is absolutely perfect. So if it's, say, an injury, and once that injury is healed, and if it's a young dog, that dog's fitting well now, would you continue the Tvati or stop it?
Yeah,
Um,
love that.
obviously if it's a chronic illness, you would continue with it for a longer period of time. But if it's just an acute injury, once that's healed, can you slow down, come off it?
Uh, That's such a great question. And I'll even refer a little bit to Dr. Graham Matheson's comment on that, because I heard him actually say that exact thing, is that if you have an acute injury and you take Tvati and it helps heal and everything's healed, you don't have to keep continuing it. But in my opinion, as an integrative clinician of practicing 30 years, I would recommend to continue taking it, because once, and even though the area is healed, and that's fantastic, and again, Sean mentioned, there are literally veterinarians reporting they cannot find the initial, I mean, this sent me over the moon, I was so excited, cannot find the original fracture on imaging, that the bone is healed so well. I mean, that is just crazy cool. But I also know that once an area of the body's been stressed, especially if you're an athlete or a performer or your dog is very active, etc., that it makes good sense. I love to be proactive and preventative as much as possible rather than reactive. And it's lovely to have amazing plant medicine tools to be reactive with. But if we can stay on top of it and ahead of it, that's even better. And so I
Yeah.
think continuing it so that, and we can talk about frequency, but yeah, go ahead, Sean.
Yeah. So I think the big thing is there from any stage from an acute injury. Yeah, look, we say use Tvati for the period of time that's required for that animal to assist in that support and healing. But I think a big thing that Dr. Katie just touched on is prevention, because uh, being in the pet space literally for the last 4 or 5 years, what's really been interesting is that we got into the market because trainers were desperate because they had an acute injury on their animal, which after a short period of time killed my life, because I'm like, but you do know you could use Tvati as prevention, because what applying a product topically that absorbs in via the skin, but absorbs into the bloodstream to assist and support these animals systemically. So it's assisting in things we can't see, because the acute injury was never really the issue. That was where the overcompensating from the first issue had then come into the acute issue. And so yes, I don't like being in the racing industry, but it has taught me so much in regards to, yes, we started off in the acute phase of recovery, but now we work in a significant space of uh, prevention. Because outside of the racing world, we now are in the companion world, where we've got dogs that are a year old that have hip dysplasia, right? So, and the French bulldogs, I think it's the little Frenchies, they are sick. They have significant hip dysplasia. And I'm like, I speak to just about every single community member we have. We call it's a community that we're building with Tvati, along with Dr. Katie Kangas and Joe, etc. And they spend a lot of money. They invest a lot of money on these animals, but then within a short period of time, they're back at the vet, and because this animal has hip dysplasia, and it blows my mind. So, when we launched Tvati into the American market, you have to go through the regulatory process of understanding how you can bring this product in there and communicate the product. And we brought it into the American market for mobility and joint conditions around arthritis. The rest, what I say to people, is a bonus, right? So now we have people using it as their dogs are aging to help in daily function. But now we have pet parents using it from as old as 10, 12 months in assisting in the hip dysplasia, because they're typically going back to the vet and getting injections and stuff that is detrimental to the animal's young life, and essentially, limiting this animal's life. It's just mind blowing, and that's why I'm really proud that I'm not proud in the sense that, because again, the racing world has taught us so much. Dr. Katie touched on pain. The only reason we knew it worked on pain is because the trainers and the jockeys and the stable hands applying Tvati to the horses, they were ringing me back and saying, Sean, I've got chronic osteoarthritis. My back and my hands are absolutely knackered. I'm like, I'm really sorry to hear that. And he goes, no, 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 I'm in zero pain now, and I can actually move with zero pain. And I'm like, okay, cool. And then it dawned on us that when you're applying Tvati to the horse, it's also absorbing in through your hand. And the Tvati Equine product is a 2 ml vial, which Dr. Katie touched on. And this is where the animal world has given so much back to us as learnings, because we don't claim to work on pain. We just know anecdotally it works on pain, because the people applying it to the animals have stated to us that's what's happened. And that's why I love the animal space, because there's no such thing as placebo. In the human space, well, I really want to swear right now, but I'm not. It does my head in. I get customers saying, hey, Sean, I can't believe I'm in no pain. And I'm like, oh, great. Is that a good thing or a bad thing? No, it's great. And the next thing they say, but I don't know if it's a placebo. I'm like, okay, stop using it.
Yeah.
A week later, they call me back and they go, Sean, I can't believe how much pain I'm in. And I'm like, is that a fucking placebo? Like, seriously. And this is why the pet space has given myself personally and our company which contains three of us because we don't have huge investors. We don't have Mars and all these businesses behind us. We're three blokes that are out there educating, that I'm privileged to talk about my traditional medicine, about what my ancestors taught my grandparents, that taught my parents, that have now given me, as a custodian of Tvati, the opportunity just to educate. Because I'm not out there trying to flog something where I can make a quick buck. I'm out there representing my culture, which is one of the smallest Pacific Polynesian cultures in the world, to an American market that give me the weirdest looks in the world, that then go invest into buying Tvati for themselves, for their pets, and then going, you know what, does this company have a human product, and now buying it for themselves? So we don't just become the well-being partner of the animal, we become the well-being partner for their families. And I think this is proof, because we have independent retailers across America that started with Tvati Pet. And now we have Tvati Equine in their stores, but they came back and said, the pet parents are saying, do you guys have a human product? And we now sell our traditional human product in pet stores across America, which is the funniest shit ever. And it's the most amazing thing to know that our pet parents are now demanding that they feel like they've got FOMO.
And right, and it's so beautiful that it can come full circle and serve us full circle like that. And I would love to tag on something that Sean said, back to Carla's great question about prevention versus just treating, post-injury or post-surgery. By the way, is also any surgery really is a great time to use Tvati too. But I think this started out as a bully group, right? So there's probably a lot of bulldogs. So Sean brought up French bulldogs having, being more prone to things like hip dysplasia. They're also very prone, and a lot of breeds are, to intervertebral disc disease, IVDD. And so that's a beautiful place to be preventative, or, treatment and follow up as well. And actually, Jessica just shared with me today that Fiona, who is, I think, the administrator or coordinator for the Raw Pet Medics group. So Dr. Nick Thompson and Connor Brady in the UK. And Fiona's little dachshund actually went through disc surgery. So she decided to get the surgery because her dog was acutely paralyzed. Like, it was very scary. And she went and saw, the conventional vets and the surgeons, and, they give the standard, discussion on the fact that if you wait 48 hours, your success rate of surgery goes way down. So she decided to do surgery, but the point is, she had already heard about Tvati and she's layering other things, but she was so excited to have Tvati as an additional tool to add in for the surgery recovery. And she wrote this great post about how her dog, so she started layering the Tvati, and again, being topical, the dog's on all these meds and post-op meds, and it's this beautiful, easy thing to add in and layer in. And she said 3 weeks out from surgery, they expected 6 to 8 at best, her dog is like totally motoring around. And she's like, oh my gosh, and she knows that Tvati has a piece in that. But again, it's a beautiful demonstration that it can be an absolutely standalone, therapy or treatment or supplement, but it can also be layered into other pharmaceuticals or other supplements. And obviously, back in Cookie's day, when he grew up, he was playing athletics and rugby and breaking his bones, and his grandma would, this is why he studied this when he went to Australia to go to med school, is because he grew up recovering from injuries by simply having plant medicine rubbed on him. And when he was studying to be a doctor, he's like, I got to figure out how that worked, because it makes no sense that,
And that's the thing. Cookie became a doctor because he wanted to help people with his traditional medicine. So it was his mission, and it's still his mission today, that, the whole thing is that he wanted to help people with a natural alternative, because he runs a private hospital here in Australia as an emergency doctor, wanting to help people, and another proud thing for me to share is that in the Cook Islands now, we have reintegrated Tvati Traditional back into our community, into the hospital systems, and we give it to them for free. So as custodians, it was really important that as part of how we built, the products was to reintegrate it back into our culture because that's what our ancestors intended for us to lead with intention to make sure that our people have access to our traditional medicine and we don't charge them $1 because that's not the way our culture does things. And as we touched on earlier, they are part of the ecosystem because when we need harvesting done, they go do the harvesting for us along with Cookie's family. And so we make $1, they make $1. We're not out there raping and pillaging. We're not out there doing things with no permission. This has been from sitting down in our culture, we sit on the floor. And the Kotunui, our traditional elders, gave permission for Cookie to be able, firstly, just to study this, and then gave permission to then commercialize this business to take it to the world. And as Cookie says, if the world wants it, we'll harvest it. But if they don't, no problems. We'll keep it for ourselves.
Yeah. Yeah.
Can I just say I love how you talk about the placebo effect in dogs and everything that you've said here. I'm sat nodding my head because it all really resonates so much with me and OxyPet, the company that I'm director of, because obviously this is something brand new to the market. And what we do is something brand new to the market. So it can often be quite a hard, I want to say the word sell, because people are like, what? They just don't always get it. But when they give it to their pets, their dogs, and some of the things that we've seen with Oxpet have just been absolutely life changing for these dogs. And I always say you can have all the science in the world, you can have all the studies and this and that, but the proof is in the pudding. Give it to your pet and watch how they respond and how they act. And that,
Absolutely.
to me, is the most beautiful thing in the world.
Mhm.
It's just
A-
magical.
Absolutely, it is. I think something that is the most powerful thing about the community that Dr. Katie has built with Jessica, that now has given myself and Tavati the privilege to join her community, as Tvati might not be the solution for the pet parent, but the community that Dr. Katie and Jessica have built is, if this is not the product, hey, we know a company that can help you. Like, so Dr. Katie shared with us, and Jessica is like, you share your bowl. And the share your bowl sort of methodology is Dr. Katie has Dr. Katie's remedies, which is a phenomenal different rounds of different tinctures, which you can touch on in a minute, Katie. But we also work alongside phenomenal companies like Totonics and Khan Lee and all these types of brands, because I will sit and talk to you all day long about Tvati, right? Because that's what I'm passionate about. But what I'm more passionate about is giving our pet parents and humans the right solution. Because if Tvati is not the one for you, I'm not going to even, say it's for you. You need to make that informed decision, because nothing's a sell when you're educating with intention. All I'm doing, I left school halfway through year 8 to go play football, right? And I was a fantastic student. I now find myself as an educator talking about my traditional medicine, which I just grew up in. I had the privilege of growing up in my culture where my ancestors, my grandparents, and my uncles and aunties, and people who I didn't even know still educated me, because I now have the responsibility of educating my 3 sons and the whole world about my culture. And that's the biggest privilege, because the pet space has given us so much, and I'm so grateful for this industry and the people that we get to work with.
Speaking of educating, Sean, and I know exactly what how you feel, exactly what you mean. We've had a couple of questions come in, and one of them I'm going to answer, if that's okay. Then you guys can steer me in the right direction if I get it wrong. But the second one, then I'm going to kick over to you two guys, because I think it's a big one. Both Petra and Jackie were talking about where the product gets placed. Jackie was asking regarding the horses why you chose the withers, and Petra was saying that she puts it on her dog's knee. There's some exposed skin there. It's an easy place to put it. So the answer I would give if I was asked that directly would be that it doesn't matter where you put it, because it's going into the system and it's igniting the body's own repair system. We chose on the back of the neck simply for convenience because it's more likely to stay there and not get licked off or rubbed off either by another horse or by the dog itself. Um,
Mm.
if that's okay, I'll continue on to the next question then. The Debbie was saying, and we've got to be really careful with this one, is I'm thinking this would be a go-to to avoid the dreaded Librela. Now, maybe that's something you want to touch on, but or maybe I'm just stepping back away from that when I'm spin passing it to you guys. Is that I mean, how do we answer that question? Because of
Katie, I'm
the
going to jump in before you.
Okay, I was gonna say I could say a lot about that. So you
Yeah,
can basically
again, and this is me. I'm a pet parent. I'm actually at my parents' farm at the moment because we've got calves coming in. So, um, I knew nothing about Librela, absolutely nothing, until the pet community started reaching out to us because my wife and I and Romeo, we're the only ones that reply to all our customers. We're not a big business, right? So we were getting emails and saying, "Hey, there's a product called Librela." So we're Googling and on ChatGPT checking what this product is. And then they're telling us about all these adverse effects. And we understand that Librela is a pharmaceutical product that is for joint and arthritis and all these types of things. And in my mind, I'm quickly Googling and they say, is this potentially a product for arthritis, etc.? And our response is, jump on a quick call because we want to try to educate as much as possible. But I think 10 months later, we've got a significant amount of pet parents using Tvati as an alternative to Librela, but we have a significant amount of customers post Librela are using Tvati and seeing great uplift in regards to their dog's recovery from using that product. So I just wanted to jump in there quickly because I knew nothing about this product. And there's another product. There's Librela and another one, Katie. I'm not sure what the other one is. I can't remember what it is, but our pet parents, I'm really glad to say, aren't using those products or even seeking those products now. They're looking at Tvati as an alternative.
absolutely. And in my opinion, I mean, I really, with the amount of data and feedback and clinical experience with Librela, I really try to steer people away from that at all. So even to say it's an alternative, like Librela has had so many issues with severe side effects up to death. So to me, I would just prefer to completely avoid Librela. There are other pharmaceuticals that are commonly used for pets, but a lot of them, when used chronically, like NSAIDs, non-steroidal anti-inflammatories, can take a toll on the liver, can, cause GI side effects, etc. So Tvati is such a no-brainer to use as your first choice over those things. Definitely, you can just kick Librela out of the scene. But even if people are using, daily pain anti-inflammatory medications, when you add the Tvati in, which will get zero side effects, I mean, nothing's ever been reported of any downside. And so why not do that as either an alternative, yes, but as, a very sensible thing to be adding in to allow the reduction or removal of, potentially removal or at least reducing pharmaceuticals. But what a beautiful timing for Tvati to get out there because Librela has caused so many problems. So, yeah, Tvati is a great alternative and solution, period. I also will back up and just tag on to Sean's comment before in that, yes, I do create products that pair nicely with Tvati. I mean, anything.
Absolutely.
But I love a layered approach. And again, Tvati can stand alone. I mean, people can do that and nothing else and be like, oh my gosh, these are great results. But I find clinically, working with animal patients for years and years, that typically when you sensibly combine, a few things, you're going to get a better outcome than if you just do one thing all by itself. So, and again, there's a happy medium. We don't want to do like excess, but doing a small collection of sensible things that work for that patient, that match well for that patient, is a lovely way to get a higher outcome. And so I do create homeopathic products. I have them here, so I'll just show them because they are in the UK. And
That was my next question. I was going to say, can we
yes,
get
they
these in the
already just
UK?
got into the UK. I'm so excited, and I'll be there soon on a UK tour. Actually, after I speak in Finland, I'll be at Helsinki, Finland in September, speaking at Dog Risk. So I will be over there in your neck of the woods, but my homeopathic products are over there. Homeopathy is such an extremely safe modality that also doesn't interfere and doesn't impact anything else, whether it's herbal, nutritional, pharmaceutical. Homeopathy is not going to, influence or impact anything else. So it's very easy and safe to tag into any regimen. And my mobility formula, the one I was just holding, obviously a very good match to use in, all the Tvati discussion that we're having, because that's going to support any kind of healing and repair from a homeopathy standpoint and pain and inflammation. I also have a nerve blend. So the nerve homeopathic blend that I created is really targeted for nerve pain. And so that's phenomenal for anything with neck and back, but even a lot of limb, issues still have nerve pain, as part of that, process in the condition. And so these just pair really well. The nerve formula too, I'll just say, is phenomenal post-op and even post-op dentistry because of extractions. So there's some really good remedies in there for pain and nerve function. So anyway, layering other things in alongside Tvati is always a wise thing to do. And multimodal, whether we're talking natural or, expanded from that, is really helpful.
For me as well with joint issues, I mean, Betty's almost 14-year-old French Bulldog, and everybody that sees us always like, I can't believe she's 14, she's so good. But Betty's had a spinal problem since being quite a young pup where discs were calcifying. And Betty has got her own physiotherapist, she's got her own chiropractor. So we do a lot of things like that as well. You can't just leave this dog with joint issues. If we've got joint problems, we want to go to a physio and find out what exercises we can do, go to a chiropractor and they help us move more. So, I think the layered approach is also so important.
Absolutely. And I love that you brought that up, Carla, because the body work is really helpful. And so again, I come from a background of Chinese medicine. I do acupuncture. I also do chiropractic. I've worked with pet canine massage therapists, etc. All of that chiropractic is so helpful. All of that, layered in is, definitely going to elevate the outcome. And, some things match certain pets or patients better. And so you find what modalities work best for them. And then that's what you focus on, combining.
Katie, quick question in from Jackie again. And I think I know the answer to this, but I'm just going to let you answer it just in case. Is it possible to overdose? In other words, the question there was if you had the 2 ml for your horse and you use it on your dog by mistake.
Sean can answer this too because he's been working with this product since the beginning. But in my clinical experience, no. Like I wouldn't even worry about that. So
You'd essentially just be wasting your money, to be totally honest. It's like when they say you can only take 40 grams of protein per day, but then you think adding a few extra scoops is going to give you more protein. It doesn't. So the funny thing is that we will give the advice of what to pet parents, but pet parents always make their own decisions. So touching on what you said before, Joe, the reason why we said to the neck of the animals is because that's where all the testing on the species was done. So we kept it to that because it was just simple. Yes, to the point where if, you apply it somewhere else, the animal can lick it off. And I think just to answer that, if they do lick Tvati, it's no harm whatsoever because it's 100% natural. So with my dog, Bam Bam, who's asleep next to me with his feet in the air, like he's always got organic coconut oil because we put it in his mouth or brush his teeth with coconut oil and all those types of things. So when you strip things back, we try give as much informative education to our pet parents, but the pet parent is always the expert.
Yeah.
Right. And we will give the best guidelines we can, and the pet parent will make the best decision for their pet. And it's for us, They just be wasting their money, and we don't want them to do that.
That's
Yeah.
exactly what I was going to say because we say the same thing to people who quite often we find ourselves just saying in a conversation, but you know your dog best, you know your cat best, whatever. And
Yeah.
it's probably the same, I don't know, with Katie's tinctures, it is the same with topical probiotics, exactly that. After a certain amount, anything more is just a waste.
Well, well,
Right,
Joe,
but
I
at
think
least
Harm
that
it.
we know it's not harmful. Like
Yeah,
if somebody inadvertently did that or didn't hear this discussion and thought more was better, it's not harmful.
yeah.
That is kind of a nice segue though for me to go into a little bit of dosing application
yeah,
guidelines that
perfect.
we offer
Yeah.
people. Is that a human takes, 1 tube a day when you start out daily. We like to do it. And for horses and medium to large pets, medium to large dogs, 1 tube a day. Small dogs, either under 15 pounds or, that's what, like 8 kgs. Sorry for you guys are all in kilograms. US, we're still very backward in our measurements, right? But anybody under that, you could start out with every other day or even a small, like under 10 pounds, like a cat or a really toy breed, teacup breed dog, twice a week,
Yeah.
can be enough for them. So it's, there's some good variability there that, people can kind of, work with it and see what works best for their pet. But that's our guideline is 2 or 3 times a week for very small pets, starting out daily for larger animals and humans. But once you've been on it for a while, and this varies for every individual, but if you've got a big injury or a big recovery that you're trying to support, I would suggest to use daily for at least 8 to 12 weeks. Most people and pets, you see positive effects way before that, but to continue using it daily there and then see how often they need it and drop down to the lowest frequency that keeps them feeling good and doing well. And for some pets, that still turns out to be every day, and humans, or 5 days a week. And for others, it's 2 or 3 times a week, and they're awesome.
Yeah,
So,
and I think along that with Katie, because we know with what we've been doing in the last 10 months is that the pet parents, they use our product for 1 or 2 months and then they will stop because they think everything's honky dory, everything's fine. And then a month later, they come back because then the dog started to slide back. Because it's like taking a multivitamins for a human. Like, so for myself, I know I wake up in the morning, I've got my supplements, I've got XYZ and my Tvati. So, as I said, I've got 3 boys. So, I know if I'm about to head out after this and start checking all the calves and the tagging and everything else that we have to do. But it's a very physical. So I use Tabati probably 3, 4 times a week. But for myself, I rub it into my thighs because it's a good area of mass, but also absorption. And, I jump out the shower, I rub it on really quickly, and I'm straight out the door. And it assists with my daily mobility. And my mum, she was meant to have double knee replacements 7 years ago, but she hasn't had to have it. But my parents run our farm, so I'm here every other weekend, but my parents still work the farm and my mum's nearly 80, right? So we're assisting in, firstly my mum, which is the most proudest thing in the world, to give her mobility, but not be in pain so she can still, be out on the farm and do what she wants to do, because when we don't use it, we lose it. And that's the biggest thing, because we're now giving families the opportunity to be able to go for the longer walk. So the walk isn't a short one and we're back home and trying to massage or use whatever it may be, the modality that you choose. So
yeah.
it's the word longevity is being thrown around so much, but if we're assisting in daily function and doing something naturally, we're helping with longevity, which is obvious.
I love that you said, I just quoted this in a podcast webinar I did, that movement is medicine. Like
Yeah.
you said, lose it or lose it. It's so true in that when there's an injury or when there's arthritis in a pet or a human, I tell people all the time with their pets that getting them out moving at least 10 minutes twice a day is literally going to bring down their levels of inflammation, bring down
Yep.
levels of pain, and support better longevity. Because once they get in that cycle of inflammation, if you just allow them to be sedentary and just take them out to go, pee and poop and that's it, things get worse. And so by using products like this and other natural support where the body feels okay to move again, then simply by doing that, you stay healthier and are at less risk for more injury and more pain. And so it's a beautiful cycle of, full circle.
Mm.
Absolutely.
Oh, brilliant. Okay, guys. I think we've covered um quite a lot there. Um, I'm I'm gonna start my thanks by saying, if I pronounce this right, Sean, that the continuity. Um, tell them from us, tell them for the rest of the world that thank you for letting this product leave the islands. And I know that they had this fantastic conversation where they said, well, we're benefiting from paracetamol and whatever. So tell them thanks for us. This is just one of the products out there that there are in the human world and pet world products that they're just natural and they work. And okay, big pharma maybe not like them, but I love the fact that you're bringing it out to us. So thank you for bringing it to us. Thank you, Katie, for getting on board and giving us that that vet take on everything. It's really helpful. And Carla, thank you for what you do in the group. It's amazing. And thank you for having us on here and inviting us. It's beautiful. Thank you.
It was my pleasure, and I'm sure that all of my members will be very, very much appreciative to have the education, because that's ultimately what it's all about, isn't it? Education. We can't do better unless we know better. So it's been a real pleasure to have you all here, and I've learned so much about it. So
Brilliant.
we'll have to do it again sometime.
Okay, well, at that, I'm going to stop the live stream, and I think all the technology worked, Carla. So well done, and
Yay!
well, yeah, we'll speak to you guys soon. Okay, take
Yeah,
care.
Thanks so
appreciate
much,
you
guys.
all.
Thank you. Take
Thank
care.
Bye.
you.
Bye. Bye.
Thank
Bye.
you.